Generalized Anxiety Disorder Among College-Age Women. I did this for my 520 class, Race, Class, Gender, and Health, last fall in Ruby's class, and I wanted to bring it back, and I studied a little bit more and kind of caught up on what's been happening in the last year from what I've studied. So a little overview about today, I'll be talking about the problem statement, the risk factors, epidemiology, cultural influence, structural factors, the community assets that are present, existing, and then I'll propose my own intervention strategies. So what exactly is generalized anxiety disorder? It is referred to as GAD, so for the rest of the presentation I'll probably say GAD because it's a very long word. It's a mental health disorder that's characterized by persistent, excessive, and unrealistic worry about everyday things. According to the National Institute of Mental Health, generalized anxiety disorder affects about 3.1% of the population and about 18% in a given year. It is a mental disorder in which excessive worry, anxiety, and consistently for 6 months for proper diagnosis must exist. According to the Anxiety and Depression Association of America, it states that women specifically have a higher rate of generalized anxiety disorder, and in fact women are twice as likely as men to have GAD. The anxiety symptoms can range from irritability, muscle tension, disturbance in sleep, and restlessness. So for the problem statement, mental health and illness is crucial in bringing awareness to the disorders that are prevalent among this population, especially in females. The college population is vulnerable during this time for transitional stages from a secondary to a higher education and being in a new and unfamiliar environment. Anxiety is comorbid with many similar mental disorders such as depression or major depressive disorder, and rarely the two exist in their pure forms. A risk factor for major depressive disorder, also known as MDD, may be the presence of anxiety as well as a pre-existing mental disorder. The treatment process and recognition is important due to windows of opportunity and prevention in secondary disorders such as GAD and MDD. Mental illness is often seen as a hidden disability and surrounded by societal stigma, and recognition of illness considered to be abnormal. Often, generalized anxiety disorders misdiagnosed, not diagnosed, or lacking in quality treatment. There also exist factors that are socially constructed that create barriers to seeking treatment, whether this be healthcare, Western perspective, or cultural shame. So here's a stat I brought up. Throughout a survey of about 800 students nationally, it included 48 states, including District of Columbia, an overwhelming majority of 64% said they are no longer attending college due to a mental health reason. The students that were in this survey did associate themselves with having a mental disorder, and of those, 64%, over half, said they are no longer attending school. So what are the risk factors for anxiety disorder? The risk factors for GAD are outlined by the New England Journal of Medicine and include family history of anxiety, emotional trauma and physical trauma, and increased stress. Individuals who have lower socioeconomic backgrounds and females in general are more at risk and likely to screen positive for depression and anxiety symptoms. Individuals that are in college may be characterized more at risk due to the competitive nature, perfectionism, and the academic environment. Environmental risk factors include parents who have GAD, childhood separation events, overprotective child rearing while growing up. Depression and anxiety coexist, and it was found that 47.5%, almost half of those with major depressive disorder, met criteria for anxiety disorders. Now the opposite is also true. 26.1% of those with anxiety disorders also met criteria for major depressive disorder. So why is this important? Understanding and diagnosing one disorder is highly critical in preventing a secondary mental health disorder and raising awareness for treatment purposes. If you treat one but not the other, the symptoms will still occur. Epidemiology. The most prevalent psychiatric disorder in the United States are anxiety disorders, social phobia, and panic disorders. These disorders include OCD, obsessive-compulsive disorder, and affect 40 million adults in the United States. According to the National Institute of Mental Health, GAD affects about 6.8 million Americans, and that's twice as many women as men. Anxiety as a mental health disorder generally has an onset before the age of 25 years old. About about 3/4 of people who have anxiety, the first episode happens before the age of 21 and a half. So why is this important? The primary episode is significant because over the course of the college age, most students will hit that age of the early onset or first episode. It is found that 10.8% of students who enrolled in college sought out counseling in the last year. That's 2 million students. So we're seeing a trend. The epidemiological data can't necessarily prove that there's an increase of prevalence rate or incidence cases that are coming up, so not necessarily new cases, but we are seeing that the help-seeking behavior has risen dramatically, and we're seeing higher rates of students coming forward and seeking help. Cultural influence. Culture constructs what is considered socially accepted as normal or deviant. Personal views of abnormality of mental illness may be kept in secret due to shame and stigma. We see this highly prevalent in the Asian communities where they aren't utilizing services for mental health because it is so stigmatized and shamed. The number of reported cases for GAD is most likely higher due to stigma and shame. Regarding culture, it's significant aside from Western perspectives that there are populations that choose spirituality and religious frameworks and become passive to healthcare in the clinical setting. For example, African Americans in a study reported they would prefer counseling and prayer as opposed to medication, where Caucasians did prefer medication. There may also be a key factor in treatment in ethnic matching of doctors and patients, which I'll get to later. So the negative view of healthcare systems may stem from historical treatments and oppression from authority as well as the majority races. It was found that Caucasians were 1.7 times more likely to see a healthcare provider and 3 times more likely to make mental health visits per year as compared to African Americans and Hispanic Americans. So for structural factors, evidence supports there's a strong correlation between those who are in college and the increase in mental health problems within the higher education system. The academic stress and anxiety felt by this population can be related to studying, taking exams, learning a large amount of content in a short amount of time, and the grade competition within the students. Structural factors include, but are not limited to, access to healthcare, quality of the care, and the range based on location, opportunity, and race. There is also an attitude that if an individual has a disorder, they are considered abnormal. It's the idea that something is wrong. The idea of normalcy and normality is socially constructed, comparing the average health of one person or a group to reference. Cultural and structural barriers may be ethnic matching. We found that about 5% of minorities are in the professional healthcare field, while 95% are of the majority race. This is important, essentially if the patient minority race are not able to identify with their doctor. This is important due to the evidence stating that different approaches to identifying illness and treatment practices, as well as the insider approach, trust, and understanding of one's culture. Another instance of healthcare is the quality of the treatment. The experiences will shape the patient to return or to not return for further treatment. The healthcare industry has been shaped by unfavorable experiences and judgment in ethnic minorities, thus creating a discomfort and less participation in seeking help. We see this in the historical case of the Tuskegee study. So what are the community assets that we can go and seek help? Community assets that exist among the college level of students who attend a secondary school are health centers, the Student Services Center, counseling and psychiatry, student organizations. College campuses have health centers, while the fear and behavior allow the reacting of situations that are triggering. Mindfulness is an approach that CBT focuses on that is present and the adaptive responding rather than the perceived worry of the future, which many GAD users suffer from. Medication as a treatment can be long-term or short-term, depending on dosages or as-needed basis, based on the individual. It is important to address the comorbidity because the anxious part of GAD on the psychosocial level may be a factor that contributes to the emotional disorders. Not all campuses have these organizations on campus, or health centers, or counseling. So I propose we make some changes. What we'll be speaking about today is understanding and eliminating the barriers, awareness of the risk factors, the treatment information, discussion of mental health, social support, community assets strengthened, and policy change. Proposed intervention strategies. There may be barriers present for those suffering from GAD that need to be addressed, including personal, structural, and other barriers. The primary personal barriers noted for college students are lack of time, accessibility, and lack of perceived need for help. The financial burden and location are also key factors. The resources on campus should refer out students to off-campus locations that are more private and suitable for the individual. As you've seen with cultural shame, they may not want to go on campus, but they may run into one of their friends. So going off campus is a great idea. The structural barriers for GAD in a clinical setting is being misdiagnosed, not diagnosed, and lacking of quality treatment. Environmental resources and accessibility to healthcare on college campuses needs to be widely distributed and further funded by the government for policy changes to allow more funding for treatment and awareness. Efforts with the Affordable Care Act and the pushing of the political agenda of HR 1100, Mental Health on Campus Improvement Act, will bring light to the issue for mental health students. The current culture and aspect that mental health is a hidden disability is often stigmatized and seen as the illness model as negative. The college campus is important to create dialogue that welcomes the help-seeking behavior and an ally for those who have mental health illness such as GAD. Mental illnesses are often difficult to discuss, especially since the actual act of discussing anxiety may create a short-term anxiety or panic attack. It was evident in research that the judgment to ethnic minorities created an unfavorable experience and consequently less participation in seeking help. Changes that need to be made are an open-minded community, the clinical setting in order to welcome help and a comfortable environment free of judgment and full of support. Hunt and Eisenberg in 2009 noted that the help-seeking behavior has changed and clinics are truly seeing higher rates of students coming forward and seeking help. So where can you go for help? Resources on campus, the student health services. We have a meditation workshop, I think it's on Tuesdays. It's Dr. Taghi and the Counseling and Psych Services located in Student Services Building 208. You can schedule an appointment in person or via phone. You get 6 free sessions, free meaning they're paid in your tuition, so you're already paying for them, so you might as well utilize them. Anxiety and stress management, Thursday is 12 to 1, also at SSB 208. You can call to register. In the fall only, they're having a women's support group where you just come, I think it's 6 to 8 weeks, and you can meet on your own as well. So I leave you with this quote. When I is replaced by we, even illness becomes wellness. Thank you.